Hey everyone, hope you're all keeping healthy.
We are happy to be back with Emma Talks, a conversation program about today's most pressing climate issues. I'm so excited, my voice even cracked.
You accelerated there. As board members of the Environmental Media Association, we're always looking for ways to bring expert knowledge into our everyday lives and make it easy to understand and apply in our own homes.
Well, with all the wildfires, hurricanes, and flash floods we saw this summer, we wonder how safe are the environments we live in, and how do the communities we reside in influence our health and the health of the animals and plants we coexist with?
And today we are super excited to be joined by our resident climate science guru, Dr. Jay Lemery, and policy fellow, Dr. Emily Sbiroli of the esteemed Climate Science Department of the University of Colorado. Dr. Sbiroli is focused on disaster preparedness and advancing climate smart healthcare.
Dr. Jay Lemery is a professor of emergency medicine at the University of Colorado School of Medicine, chief of the section of wilderness and environmental medicine. Dr. Lemery has contributed and co edited several papers on the effects of climate change on human health. In 2017, Dr. Lemery co authored Enviromedics, the Impact of Climate Change on Human Health.
And in this conversation, we are focusing on the built environment and climate change.
Basically, how climate policy in neighborhoods across America affects the health and well being of their citizens. So, welcome, Dr. Emily Sbiroli and Dr. Jay Lemery.
Welcome.
Welcome, welcome.
Emily, can you tell us what you do, introduce yourself, because we hear that you are currently dedicating a full year to train in climate and health policy.
Yeah. Yeah. So I'm an emergency medicine trained. Just finished my residency out in San Diego. And I am currently working out in San Diego in lots of different hospitals. I work in the community, we call it. So I'm not exactly doing academics anymore, but I'm doing academics sort of through Jay and this fellowship. And I actually met Jay in 2017, which was the first year of the fellowship. And I don't think you remember at all, but I met you at Clean Med. And I was so like enthralled. He was talking about his book, this new book, Enviromedics, and he was on this panel. And I bought the book like that day. I had you sign it. I wish I had it with me now so I could like show you. And then I remember you telling me about this fellowship. And I was like, okay, this is what I'm going to do. Like when I'm done with residency, because you had to finish, whatever medical training you were doing in order to actually do the fellowship. So I kind of had my eye on it for a while. But yeah, I mean, that basically it's a virtual fellowship. So I get to still work clinically, work with patients almost full time, basically, just the schedule allowing. And then we meet, pretty regularly every week, and we get placed in different organizations. So I'm working with the EPA as well through this fellowship with the climate impacts branch, and also working with another organization called Healthcare Without Harm, which is kind of like the NGO side of it. Yeah.
We have, and we'll get into some questions as well about the different areas and healthcare without harm as well. Jay, do you want to I know you stood up for this program a few years ago, and do you want to explain a little deeper from your perspective?
Yeah, sure. So, about 15 years ago was that sort of the first round of science bashing with climate and health, and it became to be politicized. And around then, I was just thinking, and I was doing a lot of wilderness medicine work, so working in remote, austere places, beautiful ecosystems. And I was like, we can debate policy, but we really can't debate science, because then we're all just idiots. And what a foreshadow that was. And around the same time, I said, well, okay, I'm a physician. Where are there other physicians? Why aren't we weighing in on these larger debates about climate and health and the health impacts? And I realized there was a conspicuous absence. There were just like no one around. So I began to pivot my career on emergency medicine training by background. Mm-hmm. My academic career began to look into more in climate and health issues. And I realized like we have got to start churning out physicians who can be credible, knowledgeable, effective leaders. And there were like zero programs or very few avenues to do this. Really, it came down to, incidental meetings, people like Emily seeing me at a conference, and maybe we spark on something, maybe we don't. But other than that, there was nothing. And so a few years ago, we teamed up with a foundation in Denver, and we started this fellowship. And fellowship is just what you do immediately after your residency training, whether that's internal medicine, pediatrics, emergency medicine. And so now we've got 5 physician fellows. We have them placed at federal agencies and partnering with NGOs working in the climate and health space. And our goal, frankly, is at the end of this year is that Emily is going to be even more of a hot shot than she already is, and be able to, force multiply her education into affecting change and doing it, wearing the metaphorical white coat, and again, being on the podium as a very convincing and articulate leader.
Mm-hmm. That's amazing.
And how do you see yourself doing that? Like, I don't know, just like, how do you explain that to, like, an everyday person? Like, what do you do? Like, what does that look like? Is it speaking at summits? Is it working to change policy? And how do you go about doing that? Just like it's all very fascinating, but also it can feel like very broad and vague. So we just want to like break it down for people.
Emily?
Sure, yeah. So I think at least for me, what this is doing, this fellowship, is giving me the background that I need, kind of what you were alluding to earlier, Drew, about really understanding what the problem is, really understanding how to talk about the problem, how to interpret the solutions. Is this a good solution for people? Is this not? To really kind of have that currency, that knowledge currency in climate and health, so that I can then apply it to wherever I want. So as a physician, for me, I plan on working with hospitals. That's just going to be with patients, with hospitals. That's what I want to do. And part of what I want is to have the healthcare sector basically be the leader in this crisis. We are contributing to the problem, as the healthcare, by virtue of patient care delivery, we're contributing to the problem itself. So to me, that's like the biggest irony in the world, right? If I'm trying to make somebody feel better, why am I contributing to their like negative health outcomes? So that's basically what I want to do with it. With the other fellows, it's really just having that background to be able to talk about it. Exactly, yeah, do no harm. But to be able to talk about it and push whatever it is that you want while having the credentials of an MD behind it. Physicians typically one of the more kind of trusted sources of information by the public. So we kind of try to leverage that. And by making us knowledgeable in also climate related policy, technology, science, those kinds of things, I think it really gives us an edge so that we can intelligently talk about it and be convincing.
Totally.
Yeah. I'll just add that, physicians, the data tells us that we are trusted advisors, right? We still hold the public trust when we sit down with our patients at the bedside and say, hey, you need to take this pill, you need this surgery. Second opinions notwithstanding, our patients look at us and they say, okay, doc, yeah, that sounds good. It's very different than almost any other profession in a very cynical age. So I think that's it's a powerful fulcrum that we have. And, that doctor-patient relationship is still, we still have it. And I'll say, although physicians are up there, nurses are number one. So a lot of what we're trying to do is build programs to bring in our fellow healthcare providers. So again, anyone who touches a patient, whether it's a nurse or a PA, or even people like pharmacists and social workers, we're thinking about how to build that clinical that clinical educational component to get people savvy. Yeah,
which is amazing. Like you said, you already have the trust factors already there. And now it's backing that up with more specific knowledge in this area, which is so important. So I like to think in the home space, I'm like the doctor of the house because anybody comes to me for their problems with their house. I just don't have a degree yet. So Jay, I just want to elaborate a little more on, so you've written on the importance of social equity in our neighborhoods, particularly as we're thinking about new climate friendly policies. Can you elaborate a little bit more?
Absolutely. Yeah. So I think social equity, one of the things we think about is, now we have this chance to reinvent our public health systems, right? And as we do that, we want to turn our lens towards advancing social equity and issues of climate justice, right? And the idea is that the most vulnerable of us are going to bear the disproportionate brunt
Yeah.
of climate change. And now COVID is mixed up into that, right? But just, briefly, we think about, what can we do to reinvigorate our communities? We think about exposure to green space, and that's important for recreation. It's really important for air quality, so kids aren't playing next to, a route of diesel trucks going back and forth to industrial areas. We think about the urban heat island effect, right? So if there's green space, communities can cool off at night during a big heat wave, and they can't do that during, if it's all blacktop, it just holds the heat much longer. We think about transportation choices. So how far do people have to walk through industrial areas to be able to have transportation? And we're trying to decrease the importance of using cars, right? So whether it's scooters or subways or other mass transit. Within this also, we think about food deserts, right? So the idea that, do people have access to good, nutritious food, which again, in our most vulnerable communities, all they have is like a 7-Eleven with processed food and Slurpees, and then at a bigger picture, in terms of reinvigorating communities, we think about economic opportunities. So how can we bring in resources to train a workforce, historically hasn't had great opportunities towards infrastructure rebuild, things like disaster response, which I think has a real, one, it's important for the resilience of a community, but also allows us to give skill sets like first responders to people that allow them entry-level jobs into the healthcare sector, which is, like a fifth of our economy. And then also emerging jobs like renewables.
I think it's so fascinating that you guys as doctors get to apply this broader lens. It's so cool that as doctors you get to look at, and so important that you are looking at urban planning as it pertains to health. Can you tell us what it requires of you in terms of like collaborating with other roles, with other positions, city planners, because it does sound so collaborative, like you wouldn't expect a doctor to be talking about.
Let me just say something that I'm going to turn over to Emily, which is, you think this is like a great idea, right? But even within medicine, like we have eaten a ton of, from our colleagues who say that advancing social justice is not the role of medical education. We want patients, physicians that know how to treat patients, not give lecture on gun control, obesity, or any of the other,
which is
pandemics.
Total bullshit, because you're the ones with the knowledge and you're the ones with the experience that can be dramatically changing our lives for the better. Yeah, totally.
Absolutely. I'm going to put in the post, and perhaps we can put it out there, some op-eds written by a prestigious journal that, again, hammer us for having this different view. I mean, when you think about how medicine started, medicine really came to, looked at the society as a whole and say, if we're going to fix these diseases, we have to go to the root of the problem. And you can't just always fix someone at the bedside, right? You're way late at that point.
Yeah, well, 100%. I mean, that's the thing we look at. I call it lipstick on a pig. You're not doing anything if you keep just slapping a little bit of lipstick on the pig. You need to get to the root of the problem. And if it's not for you guys, the professionals that are the ones that people look up to in our industry, in society, then who else? I mean, a lot of people just don't have the knowledge, or they don't have the ability to help lead in the direction we need to go.
Yeah, and Drew, like we have been, because a lot of us are on Twitter. This is how we communicate, right? Like many people, we've been labeled left-wing medical Twitter, just because we're taking an activist role in issues like climate and health, because we're looking at the science and saying this is gonna suck. It's gonna affect the future of all of our health. And so it's surprising how much backlash there is.
Honestly, I think the one thing, this is my opinion, but people get their defenses up when they are with the unknown. People get their defenses up when there's change. People get used to a certain routine. And unfortunately, in our society in North America, we have a lot of systemic routines that have been hammered into us generation after generation, and they're not the best for us. They're not the healthiest for us. This is everything from healthcare to the home, our home, the way we operate in our home, education. So I strongly agree that if we all just took a breath and took a step back, just to realize it's a good thing to consider something different that could give us a better outcome, a healthier outcome for all of us. but it's sometimes people are
Yeah. But maybe Emily could go back to you, because one of the things that she's doing now is bringing the physician perspective into a place that has almost no doctors, but they're still charged with community health at the EPA.
Yeah. Yeah, no, that's exactly what I'm seeing, and what we're doing is a lot of people have their, at least at the EPA and the folks that I've been working with and exposed to, kind of have their heart in the right place. You know, they have all these different backgrounds, and they're scientists, they're geologists, they're planners, they're engineers. But no one is really like a physician who's able to kind of see firsthand how these impacts are actually affecting people, you know, patients. When there's a wildfire, like what does somebody look like who has asthma? When there's a heat wave, somebody who has cardiovascular disease or hypertension or diabetes, what does their day look like in a heat wave, right? They don't actually get to see kind of that part of it. And so that's what I get to bring to the table and to those conversations there. And I'm in turn learning just so much about what policies are out there, how the government actually works, how, you know, when we're trying to make change. I'm learning just a ton. So it's just been a really kind of collaborative, interesting dynamic to have me there, kind of bringing in, hey, actually, you know, I think it's important that you guys do this health fact sheet for children with asthma during heat waves because of XYZ, you know. So it's been a really, really cool experience with that. Yeah.
And with all the labeling that Jay's talking about in your industry, people just coming after you.
Yeah.
Last chance to get out, go into, you know, something calm like a yoga instructor or zenning. No, I think it's really great that what you're doing, you're taking the initiative, you're bringing your knowledge and expertise into an area where people might not have been able to have that guidance. And
Yeah.
so, and can you talk a little bit more? You mentioned it earlier as well, but can you talk a little bit about the healthcare without harm?
Yeah, sure. So Healthcare Without Harm, their organization, they basically, their goal is to get the entire healthcare sector, the global healthcare sector, to carbon zero. You know, they're taking this, you know, first do no harm adage pretty far. So what they're doing, I mean, I'll just basically share one statistic that I remember off the top of my head right now, is that the US healthcare sector contributes about 8% of total US emissions. So just the healthcare sector itself is 8% of all of our country's emissions,
Wow.
which is pretty significant. Yeah. And that actually kind of went down. So we're actually doing a little bit better. But in their latest report, it's 8%. So they actually came out recently back in April of this year with for the first time, they basically baselined where we are on a global scale, where the healthcare sector is on a global scale, baselined our impact, and created this kind of global roadmap to decreasing in the decarbonization of the healthcare industry globally. So this is the first time that they really released something like this. It was a collaboration with the WHO, with the World Bank. So it wasn't just Healthcare Without Harm, but it was kind of this whole big international collaborative.
When they're looking at that initiative to decarbonize, are they talking about in the work facilities, or are they also talking with the vehicles that they're using? Is it every aspect of everything healthcare?
It's all of the above. So when we talk about emissions, we typically talk about scopes. So like scope 1, scope 2, scope 3 emissions. And so it's talking about all of that, trying to take all of that into account. So yeah, it would be energy, it would be buildings and infrastructure, it would be pharmaceuticals, supply chain, business admin type, you know, like practices. So it's basically their goal is to try and get healthcare sector globally to carbon zero by 2050 with this new report. So it's
amazing.
Yeah.
I thought with COVID it would have increased. You said it has decreased the total emissions.
So the total emissions compared to about a decade ago. So COVID, we actually are pulling in some of the data now. I actually have a meeting in about a week to kind of chat about what that data looks like from 2020 and to kind of unpack it and see what happened during COVID. You know, it's kind of hard to tell because some hospitals didn't get hit as hard as other hospitals and didn't necessarily have as many patients as other hospitals. So we'll see.
Yeah, when you look at the nature of like PPE and everything that is used in patient care, it's and of course the topic of like sanitation, like it seems like waste goes hand in hand, but it would be cool to if we could find a solution.
Mhm.
Absolutely. Yeah. That's like the one thing that I always kind of every shift, right? It's like that balance of patient safety, making sure that we're not transmitting anything crazy. You know, patient comes first, right? For me, for healthcare, versus, you know, my impact, right? Yeah.
Can you guys talk a bit more about how COVID has affected your work?
Yeah.
Yeah. There's a few things. Well, there's the emergency medicine part of it, which has just been overwhelming. We have seen so many different waves of COVID. At first, it was extraordinarily scary. Um, our friends in New York got hammered hard. Lorna Breen, who was the physician that succumbed to suicide, was a dear friend, and we trained together. And she was an administrator in a New York hospital, which again is just sort of epitomizes the mental health toll on so many healthcare workers. And it's been scary because we're now have run out of basic things like ICU beds to take care of people in the manner that we were trained to do.
Mm-hmm.
Now we're pivoting, right? And so people with COVID that are vaccinated, I'm just going to say it, they're just not sick. They come in, they have COVID, they may be uncomfortable, they may have, viral symptoms, but generally they're just not sick. It's the unvaccinated now that they're still succumbing to the horrible things. And that's difficult. It's very difficult as a care provider, but also society member to look at them and say, why not? And then, people will be gasping for words. And yet the words that they want to tell you as the care provider is that I still think the vaccine is BS and I'm glad I didn't have it. And it is extraordinarily difficult to find empathy and compassion in our job. I'm just going to say it.
Yeah, I mean, I think one aspect of that that's a little frustrating too is that there has been just so much misinformation. And then again, people being led by those who are maybe not the right people to be giving whatever information about COVID or the vaccine and whatnot. To me, that's the frustrating thing, is that people stick in with those that they trust, but if the person they trust is not the person who has the right information, how are you gonna get through to someone?
Totally. Yeah. I mean, it's crazy.
I wanted to jump back, and again, Jay, if you want to talk about this, by all means. So I was reading a little bit about cities historically built around belching factories and huge consumers of energy. Per capita, they're more energy efficient than suburban and rural areas. Can you expand on that a little bit? I mean, it doesn't seem like that would be a healthier place to live, but from what I was reading, it sounds like those communities are.
Well, they're definitely, it's right. It's a crazy paradox, right? Because you don't think about that. You think farms are super healthy, places to live. But the truth is that per capita, cities generally use less energy per person because they just don't have as many energy consuming resources. They don't have the big Ford F-150. They don't have huge houses to warm. They live in an apartment generally, and they're walking a lot more because that's just the nature of a city. Now, that's true for you. Some people live in very destitute parts of a city, and that's, I guess, different. But on whole, yeah. And I think what's interesting is that cities have been incubators of innovation for a while, particularly with resiliency and sustainability. That group C40, which is the 40 largest nonprofit, the 40 largest mega cities in the world, and now a lot more. They've been doing a lot of meaningful work, particularly when I would consider the dark ages of climate change, which is pretty much the last 15 years, maybe 20 years, where there's been a paucity of meaningful action, in international governance and certainly at the federal level. But at the city level, they actually have been doing very innovative things, So even New York City has done a lot to advance bike lanes and green space. Paris is now a bike city, which if you've ever been to Paris, the amount of people sort of smoking and honking their cars in the traffic. It's remarkable to think about that. And I've seen pictures where now there's just full of bikes, and that's a very powerful picture. And even here in Denver, right? So the last election, the Denver voters voted for a climate fund, which now generates $40 million in revenue for the city
Oh,
to
wow.
reimagine sustainability and energy use and to advance climate justice. So to me, it's very exciting. And I think, the wins we see in our large urban areas hopefully will translate to the state and federal level as well.
For the record, I mean, I love seeing changes like what you're saying in Paris too, but I also heard that Paris is so forward thinking that they don't just have clean water fountains for everybody. It's filtered water. They also have what do you call, like sparkling water for
Oh yeah,
everybody.
Perrier.
they're so
Perrier, they
fancy.
have, and that's like in the park, the little fountain that you drink out of. They also have like Perrier fountain. Anyway,
That's awesome.
so one thing I want to touch on, obviously the home space is very important to us because we truly do believe everyone deserves to have a home they love, somewhere they feel secure, somewhere they feel really speaks to them,
And a
and
healthy home.
a healthy home. Yeah, exactly. And so a big thing for us that we're really working on is decarbonization of the home space. And so you're thinking of new builds. A lot of people, they're brainwashed into thinking certain things are best. A prime example in the home space is gas for cooking. Everyone, it was just a great marketing campaign years and years ago where if you want to cook like a chef, you need an open flame. In reality, it's not great. It's uneven cooking. If you look at induction is even cooking. It's fast. Kids aren't going to burn their hand on the surface. So there are a lot of things that are just education tools that we've been working on to try and let people understand this isn't just actually better for you for cooking or whatever it might be, but it's also going to create a healthier environment for you and your community.
And I just wanted to add to that, like education tools for us as well, because we've used how many gas stoves in renovations and designs, but it's a matter of like us growing up with what we knew. So it's important for us to be just as curious in order to relay this information to consumers. What, like when you talk about brainwashing, it's not like, I think we've all been there. We are there, and it's so easy to, because we have grown up with what we have now. So
It's hard to make the transition, right? Because you know what you grew up with, and now we have to continually reimagine that. Think about what do we still need? I mean, I still need gas to get around, sadly, but that's the world we live in. One question I want to ask is that are you guys collecting green hacks or sharing that with your ecosystem? Because to me that I feel like
Yes.
people have appetite for that. Yeah, but I don't know.
I have an appetite. I want to know.
Oh yeah, we always have an appetite. I love learning something new that's a little hack. Now, are you talking about in general, like your home for home life? What are you thinking?
Yeah, I mean, we watch you guys because you guys make us think about our house in different ways and how much better we can live. And so, yeah, but I mean, I think about the work that you've done and, the Habitat for Humanity Award that you won, Drew. And I think about like, oh, you'd be a wonderful place, you and Linda, place to go to be like, okay, how do I hack my home? And maybe, I've got $100 to spend, or I'm thinking about moving, what do I need to look for?
Well, we do. I mean, when with Habitat, I mean, I was honored to be, Jonathan and I were considered, Habitat humanitarians, and it's quite an honor to be bestowed upon us, but it's just because of our passion for the environment and just keeping, creating a healthier space for everyone. We've built homes from Alaska down to, areas of Florida with Habitat. And so, we've done a lot, on our social media and in interviews, we talk about tips and tricks and things to do around the house. Not everything has to be, solar panels that can be more expensive. There are a lot of smaller things that you can do. But, like Linda and I actually have a show that we're pitching to HGTV that we're talking to them about that is actually going to be completely green build. And
That's cool.
like decarbonized. It's like it's going to be such a beautiful build, and every aspect of the build is going to be something that's sustainable or eco-conscious. And so I think there is an appetite for that. It's growing. I think the approach that we like to take too is we don't like to attack somebody for not being green. For example, gas is here for a while. It's not disappearing. Yes, we're reducing the amount of dependency that we have on fossil fuel, but it's not like an overnight switch that we can flick and all of a sudden we're all green. So with that in mind, we're trying to show people here are other options, something that may not pollute as much, something that is better for your home and your health.
And this is why we love working with EMA, because we're always trying to figure out the formula that works in terms of storytelling and educating. because we never want to preach. And I think for us, like where it feels the best is where like we take them along on this learning journey, because we get to talk to people like you, Dr. J and Dr. Emily. Like you say, you look to us for, how to make our homes better places to live, but really like it's joining the design, like the aesthetic with the health and the science.
Yeah. And actually that's a big part of, for us, one of the biggest things we love, that's why we love At Home, our podcast, and working with Emma for Emma Talks, is because this gives us the ability to give a platform to amazing gurus of climate like yourselves to help educate everybody.
Yeah. And then just go back to the beginning, right? Talk about like the need for multi-sectoral collaboration. I mean, that's why as academic physicians, we go to Emma, because we get to think beyond our silo. And this is not going to be a problem fixed within the silo, for sure.
Yeah, absolutely.
We wanted to sort of wrap up. We haven't talked about climate medicine yet. Hashtag climate medicine, right?
Hashtag climate medicine.
Hashtag climate medicine. Can you elaborate a little bit more on that?
Sure.
Yeah, Emily, go ahead.
Yeah. So I think, I don't want to credit us, but, we are basically the pioneers, right, of this kind of new genre of medicine, these new genre of healthcare workers who really have this kind of broader macro understanding of what are the effects on human health overall, and how can we move forward as a society. So I think climate medicine is the overall idea that the healthcare sector and healthcare workers should be leading the movement in some way, or should be heavily, pioneering it or providing whatever support that other collaborators may need. So that's what I think, I personally, how I see it, and what I think climate medicine is. It's really being able to talk about the problems and relating it always back to human health, and making sure that we're doing the right things and being preventative. One of the things that actually COVID kind of taught me in general was this idea of preparedness and being ready for something. And one of the things that, COVID really showed us, I mean, the healthcare sector as an entire, global sector wasn't ready for COVID. We just weren't. We had maybe weeks to 2 months at best to really prepare for something like this. And the results, like, frankly, were pretty disastrous. We didn't do a good job kind of managing this pandemic overall. But with climate and the climate problem, we have like decades of information now, and almost decades of knowledge and data and technology and ideas that we just didn't have with COVID, right? So imagine how much more prepared we really are, just kind of every sector everywhere, to really deal with it. And I just kind of think about it. Imagine if we had like the 10-year head start on COVID, right? What the healthcare sector would have done, and how this entire pandemic would have looked. So that's what I think kind of is the crux of climate medicine, is also this appreciation of getting everybody ready and preparedness and understanding what's going on. I mean, the latest IPCC report, the one that just came out earlier, a couple of highlights from there basically strongly suggested that we've already entered a period of no return in some of these climate impacts. So things like rising sea levels and rising ocean temperatures and the melting of the ice sheets. The data, basically the science behind all of that, has suggested strongly in this last report that we've already entered kind of a period of no return.
Yeah.
Which is critical to know, right? It's critical for the urban planning point of view. It's critical for patients. It's critical for governments. It's critical for all industries everywhere to really know that and appreciate that even if we make a huge, colossal effort to mitigate some of these things, we still have some things that we just have to be prepared for that may still be affecting us and happening. So,
well, like Dr. J said earlier too, I mean, you look at stats that are based on science, you can't argue it. You can't argue with it, or you're an idiot. And so I think that there is so much more information that we have, that I'm just glad that more ears are listening now, that at least I feel people are opening up to what we have to do. And I think it's us continuing to use our voices in a way that's not attacking people with differing opinions. It's educating and hoping that they'll open up their minds to new ways of thinking. That'll make a difference. And I wrote a song about your hashtag climate medicine.
No way.
A spoonful of climate medicine helps a happy planet go around. Okay, I made it up on the spot. But anyway, we like to wrap up with a speed round, if you're game.
Sure.
All right. And you can both answer independently if you like. So what meal makes you feel at home and who cooked it? Emily?
Ooh. Definitely roasted peppers from my grandma. My grandma's super Italian and she makes them with capers and parsley and Parmesan and just nice roasted pepper dish.
Nice.
Yeah.
I'm penne bolognese from a fancy Italian restaurant. Sorry, Mom.
What are your favorite / nerdy hobbies at home?
/ nerdy. I feel like everything I do is nerdy these days.
Linda's the super crafty one, so I'm sure that there must be something. Mine, I collect coins, so that's my thing at home. Old ancient coins.
Yeah, that's
I just
great.
joined the San Diego Plumeria Society because I'm obsessed with plumeria flowers and I've been planting them like all in my backyard. And apparently they have a society and it's $35 a year. So I joined it and, got to learn about plumerias.
I think Linda might join your society.
That's so awesome.
Right?
I'm a member of the Denver Astronomical Society. Are you ready for this tagline? 1 mile closer to the stars.
Oh
my gosh. I saw that you have your NASA side to you, like some of your past work in history, and we love that. We love NASA, and we've gone several times to their facilities, and they've taken us through some of their like simulated gravity at different points, like the moon or the space station. Oh my gosh. So I could super nerd out. They even have like for innovation, new technology, they actually have the robot wars. They bring students in who build robots and then they battle them out. It's hilarious.
That's awesome.
All right. So what smell reminds you of home?
What smell? Probably like garlic.
Is that a good thing?
That's a great thing.
Maybe.
Jay?
I'm going to say shout out to the Adirondacks and say wet mud.
Wet mud. Oh man, I do know that smell.
Name 3 things on your bedside table.
Game of Thrones, the book. The book that we're reading for the book club, Jay. What's that one? The one by Robinson.
Kim Stanley Robinson, Ministry for the Future.
Yep, and a journal.
Oh, amazing.
Yeah.
I have my noise canceling headsets. Thank you. I have a pile of books that I'm supposed to be reading, and I tend to just watch Netflix, and then a glass of water.
Oh yeah, Linda and I are nerdy book readers, but I tend to have a pile that takes me forever to get through. Last question: what is a memorable growth moment for you?
Ooh, like recently?
It just and whether you're young or recently, whatever it is, but a moment that was really helping set you on the path that you're on.
Yeah, I think basically COVID and intubating patients with COVID. That's when we put a breathing tube and kind of put them on the ventilator. And really just like being faced with the unknown. This was kind of in the beginning when it first started and we didn't really know what was going on. And just kind of like putting my guts to the unknown there and being like, okay, I'm learning how to do this very important skill while trying not to freak out that I might get a deadly disease and spread it to everybody here. So that was a pretty significant learning point.
I was a rower in college, and I kind of went to college just sort of, wimpy and entitled. And my coach said to me, I did. I rowed. Yeah.
I like hearing guys from college say that. Wait, you row crew?
Yeah. I row crew. And my coach said to me, he said, hey, if there's a problem in the boat, it's probably your fault. Like, always think that. And it changed the way I sort of viewed the world.
Huh.